Hello, my name is Laura Huppert, and I'm a breast medical oncologist and assistant professor at UCSF. I'm excited to present an oral abstract at AACR on behalf of my research collaborators entitled Development of a Novel Assay to Detect Circulating Tumor Cells in the Cerebrospinal Fluid of Patients with Leptomeningeal Disease. Leptomeningeal disease is defined as cancer cells in the cerebrospinal fluid and/or the leptomeninges surrounding the brain and spinal cord. Approximately 5 to 10% of patients with metastatic solid tumor malignancies develop LMD over the course of their disease, and prognosis is unfortunately poor, on the order of less than 6 months. Diagnosis can be limited by the availability to detect tumor cells in the CSF, and unfortunately, treatment options are really limited. Therefore, it's really important to develop novel methods to detect and characterize the circulating tumor cells in the CSF, to understand the biology of these tumor cells, improve LMD diagnosis, and identify novel therapeutic targets. In this work, we collaborated with the company RareCyte to develop a novel method for detecting and characterizing circulating tumor cells in the CSF. Specifically, after we collected the CSF cells from patients, they were transferred to a slide, stained with a fluorescent stain, and then scanned and analyzed to determine the number of circulating tumor cells, and also to detect the estrogen and HER2 status of these circulating tumor cells in the CSF. We first used a cell line and mock CSF to test and validate this system, and then we actually tested samples from patients who had known or suspected LMD to see if we were able to detect the tumor cells and characterize them from patient samples. We demonstrated with clinical samples that these cells could be detected, enumerated, and analyzed, and we were able to evaluate the ER and HER2 status and correlate that with the ER and HER2 status from the known receptor status of the peripheral samples from those patients. This work has the potential to improve detection of circulating tumor cells in the CSF and identify novel therapeutic targets. Our next steps are to validate this work in a larger cohort of patients, and then hopefully in the future, we can use this assay to help track disease and identify treatment targets for these patients.